from diagnosis through surgery and right into post-operative rehabilitation.
Right, the full package again.
And they're also using innovative approaches, things like personalized rehab plans tailored to the individual, and increasingly minimally invasive techniques to try and improve outcomes and speed up recovery.
So it's not just the procedure itself, but that whole recovery journey seems to be a key part of the offering. What about cosmetic surgery? That's often associated with medical tourism globally.
Absolutely. It's a booming area in India as well. Procedures like facelifts, rhinoplasty nose jobs, liposuction, breast augmentation, these are all popular and often available at a fraction of the cost you'd find elsewhere.
I imagine the cost difference there is a huge draw for procedures that often aren't covered by insurance.
Yeah.
But it's not exclusively elective or aesthetic, is it?
No, that's a good point. The sources note that reconstructive surgeries are also a significant part of this, helping patients maybe recover function or appearance after accidents or illnesses. And interestingly, there seems to be a trend in some clinics towards a more holistic approach in the cosmetic space too, combining the surgical procedure with non-invasive treatments and lifestyle recommendations for more comprehensive, maybe longer-lasting results.
That's an interesting evolution, taking a broader view. And what about more serious conditions, like, say, cancer? Is that an area where people travel to India?
Yes, cancer treatment is another area where India has made significant advancements, according to these materials. There are state-of-the-art cancer centers offering the full spectrum of oncology care: surgery, radiation therapy, chemotherapy, immunotherapy, the works.
Are they using the very latest treatments available globally?
They seem to be adopting cutting-edge technologies quite rapidly. Things like targeted therapies, precision medicine where treatment is tailored to the patient's specific cancer genetics, and even proton beam therapy.
Proton beam, that's quite advanced, isn't it? Offers more targeted radiation.
Exactly. It can potentially reduce side effects compared to traditional radiation methods. So yeah, India is attracting patients who are seeking these advanced, sometimes more personalized cancer treatment options that maybe aren't available or affordable where they live.
That's remarkable, not just providing access to existing treatments affordably, but actually being at the forefront with some of these new technologies. One more area, what about fertility treatments?
Fertility treatment is another major draw. It's sometimes even referred to as fertility tourism. Procedures like IVF, in vitro fertilization, can be a huge financial burden in many countries, especially where they aren't covered by insurance.
A massive one, yeah. Often multiple cycles are needed too.
Right. India offers these treatments at significantly lower costs, which provides hope and, frankly, viable options to couples from all over the world.
And the quality is there.
Well, the sources suggest they combine advanced reproductive technology with highly experienced reproductive endocrinologists, leading to competitive high success rates.
Okay, so it sounds like India offers a genuinely comprehensive suite of high-tech, advanced medical services across a whole range of specialties. But these sources also point to something else, something maybe a bit different, that makes India's healthcare ecosystem kind of unique, something rooted more in history.
Ah, yes. That's the blending of modern medicine with ancient healing traditions. India is, of course, the birthplace of practices like Ayurveda and yoga.
Right, thousands of years old traditions. And it seems these aren't just offered as separate alternative options, but they're actually being integrated with conventional medicine.
That's what the sources highlight, and it's quite interesting. There's obviously a growing interest globally in holistic well-being, looking beyond just treating symptoms to addressing root causes and focusing on overall health.
Definitely a trend.
And India, with its deep, deep history in these traditions, is kind of uniquely positioned to offer this blend. It's not an either-or situation.
So you could potentially receive, say, a cutting-edge orthopedic surgery and then incorporate Ayurvedic treatments or therapeutic yoga into your recovery plan, all within the same system or coordinated approach.
Exactly. That's the idea. It creates this integrated healthcare ecosystem. Some patients are drawn to India not just for the affordability or the technology of the modern treatments, but specifically for the option to explore these ancient practices alongside conventional medicine, or even sometimes as a primary approach for certain conditions. It represents a more balanced, integrated view of healing that seems to resonate with a lot of people these days.
That blend really does feel unique to India. It adds another layer, another dimension to its appeal as a medical destination beyond just the clinical aspects. Okay, so we've covered the individual experience, the types of treatments, this unique blend. Let's maybe zoom out for a moment. What's the bigger picture here? What are the implications for India itself as this whole industry grows so rapidly?
Well, on the one hand, Medical tourism is clearly a significant economic engine for India. It brings in substantial foreign exchange, it creates jobs, both directly in healthcare and indirectly in hospitality, transport, etc., and it stimulates investment in the healthcare sector overall.
Okay.
The sources point to it helping position India as a global healthcare leader, which in turn fosters more innovation and further development within the country.
So it's a clear economic win for the country, boosting GDP and development.
By many standard measures, yes.
Yeah.
And crucially, that investment in top-tier infrastructure and expertise, driven partly by international demand, often benefits local patients too. It can help improve the overall standard of care available within India.
So potential positive spillover effect for the domestic population.
Exactly. It could be a case where international demand helps build domestic capacity and raise standards across the board.
That sounds like a positive feedback loop. But, any area experiencing such rapid growth often comes with challenges or complexities. What considerations or concerns do the sources raise regarding the impact on India?
They do note several complexities. One area of concern mentioned is the potential for exploitation of medical tourists themselves, things like possibilities of overcharging or perhaps recommending unnecessary procedures to maximize revenue.
Right, the vulnerability of being a patient far from home. So the research and due diligence we talked about earlier become even more critical for the patient to protect themselves.
Absolutely.
Yeah.
It just underscores the need for patients to be really informed consumers, and on the flip side, for hospitals and providers to maintain transparency and strong ethical practices.
Makes sense. And what about the impact on India's own healthcare system and its own population? Is that discussed?
Yes, that's another crucial point the sources address. While these high-end facilities catering to medical tourists are often world-class, there's a concern raised that this intense focus on international patients could potentially strain resources.
How so?
Well, it could divert skilled medical professionals, doctors, nurses, and maybe significant investment away from serving the needs of the local population, particularly perhaps in more rural or underserved areas of the country.
So it sounds like a potential challenge of balancing the clear economic benefits of medical tourism with ensuring equitable access to quality care for everyone living in India.
That's precisely the tension highlighted in some of the materials. The growth of this high-end medical tourism sector, while positive economically, requires really careful policy and planning to ensure it doesn't inadvertently worsen existing inequalities in healthcare access within India itself.
Right.
It's a complex, ongoing conversation involving policymakers, healthcare providers, and communities how to harness the benefits without compromising the needs of the domestic population.
So it's clearly a powerful force with undeniable benefits both for patients and for India's economy, but it also necessitates very careful consideration of its broader societal impact and ethical dimensions.
Exactly. It's a dynamic space, full of potential, but also raising important questions that need to be navigated responsibly as it continues to grow.
We've certainly covered a lot of ground today on medical tourism in India, pulling together insights from these various sources you provided. If you had to distill it, what's the core takeaway you hope our listener considers from this deep dive?
I think it's that medical tourism in India offers a genuinely compelling combination, potentially high-quality care, often at significantly lower costs, plus these unique cultural elements we discussed. It makes it a viable and attractive option for many people seeking medical treatment they might not otherwise be able to access or afford.
And there's always a but with big decisions. It's not something to jump into lightly.
Not at all. It absolutely requires diligent research, very careful planning, and a clear awareness of both the incredible opportunities and the potential challenges. That includes understanding the broader impact of the industry itself. Making a truly informed decision is paramount.
Well said. India has clearly established itself as a major force, a leader in innovative and affordable healthcare, offering this incredible range from advanced cardiac surgery to ancient healing traditions. Ultimately, your personal health journey is unique, and finding the right path for you, wherever that path may lead, is the goal.
Agreed. Couldn't put it better.
And as we wrap up this deep dive, maybe it leaves us and you, the listener, with a thought to ponder. As healthcare costs continue to rise globally and our options for where and how we receive care keep expanding beyond traditional borders, what does it truly mean to ensure access, quality, and equity in healthcare, both for individuals navigating their own needs and for nations grappling with the complex demands on their systems in this increasingly globalized world?